don't blindly trust anyone. You should be using everyone as a data point and a source of information. But we live in a day and age now that is very exciting because just over the past 2 to 3 years in history, we now have access to affordable, more direct-to-consumer lab testing, wearables. We can know more about our body through the click of a button online by ordering a set of labs than we could have known ever before. And so we all need to get off that indoctrinated conditioning about, it's the doctor's job to understand my health and be the CEO of our own health.
Hey, everybody, I'm Marisha Weiss.
And I'm Jen Giammo.
Welcome to another episode of Everybody Talks, the podcast where we explore the wide world of wellness. Sometimes we talk to experts, sometimes we talk to each other, but we're always talking to you.
Every week, we discuss topics from nutrition and exercise to mindfulness and self-care. And today, we are talking all about optimization culture and what that means.
Let's get started.
She is a Stanford-trained physician and co-founder of Levels, a health technology company with the mission of reversing the world's metabolic health crisis. She trained in head and neck surgery before leaving traditional medicine to devote her life to tackling the root cause of why Americans are sick.
She's been featured in the New York Times, the New Yorker, the Wall Street Journal, Forbes, and Women's Health. And she's the author of the #1 New York Times bestselling book, Good Energy, which was released last May.
I like that you brought good energy to that sentence.
I did. And she's here with us today. Please welcome Dr. Casey Means.
Hello.
Casey, hi. How are you?
Hi.
Welcome to Everybody Talks.
So happy to be here. Thank you.
Thank you so much. I'm so glad we met you when we did back a couple months ago.
That's right. And then, we saw your book shoot to the top of the New York Times bestseller list, which is very exciting for you. But why don't you tell everybody a little bit more about yourself and how you got started on this path of good energy?
Absolutely. So I trained as a medical doctor in the Western system. I, did what all the medical students in the country do, went to medical school. I was at Stanford, and then I went to head and neck surgery residency. And I was about 4.5 years into my training in head and neck surgery. And it kind of hit me like a ton of bricks, right as I was about to kind of launch into my full career post-residency that, while I'm here in the operating room, 60, 70 hours a week and, kind of tweaking the sinuses and the ears and things like this, the reality is that around me, American public health, it's very poor, and it's actually getting worse every single year. And it doesn't seem like we're doing a great job as physicians really managing this tidal wave of chronic illness that is hitting Americans right now. And you probably know this, but life expectancy is actually going down in the United States. We spend twice as much as every other country in the entire world on healthcare, and we're not even keeping it stable. It's going down. So something's really not working. And so I think for doctors, if you're kind of looking at the reality of the American healthcare system and outcomes today, and you're not scratching your head and saying, what's going on? You're kind of missing the forest for the trees. And so I'm here deep in my subspecialty in one little part of the body, realizing, hey, there's a bigger issue we need to focus on. And it's sort of like, if not me and my peers, who's going to do this? And so I started unraveling that thread a little bit, and it started hitting me, even in ENT and ear, nose, and throat surgery, a lot of the patients who come in for their surgeries, they come back the next year with the same problems. And I kind of just started asking why and digging and digging. And what I found, really going back to the data and looking through this different lens of root causes, what's really happening here is that basically every chronic disease we're facing in the United States, the top killers of Americans, heart disease, type 2 diabetes, Alzheimer's, dementia, cancer, chronic liver disease, they're all related by really fundamentally similar biology that's going on in the body. And when you actually, the symptoms all look different. Sure, of course, Alzheimer's looks different than cancer, and that looks different than type 2 diabetes. But that's the symptoms. That's sort of how it manifests. If you actually go down on the invisible level inside the cells and read the literature through that lens of what's really happening in our bodies, it's all the same stuff with each of these diseases. And what that thing is, that sort of centralizing core, is this concept called metabolic dysfunction, which I think is becoming more and more, we're hearing that term more, but it might be the most important term in America right now, metabolic dysfunction. It's something that 93% of Americans are dealing with based on the most recent research from the American College of Cardiology. So more likely than not, an American is dealing with metabolic dysfunction. And if that invisible cellular physiology is present, that dysfunction, it is going to drastically increase your risk for all of these diseases, and also just so many of the symptoms that are kind of annoying us today that are becoming all too common, like chronic fatigue, chronic pain, joint pain, depression, anxiety, brain fog, bad menopausal symptoms, gout, erectile dysfunction, infertility. You go to the research looking through the lens of root causes, they're all linked to metabolic dysfunction. So once I sort of came to this realization that I had not learned at Stanford Medical School, I just said, I basically have to stop being a surgeon. This is what I need to be focusing on. And also just figuring out, why aren't we talking about this? Unfortunately, that led me down a whole different path of healthcare incentives, which is essentially, it's not profitable to get to root causes. That's the reality. If you can send someone and say, hey, you've got all these different symptoms, see all these different specialists for all these different symptoms, and no one actually gets to the root cause, that's 5, 10, 15 specialists billing for all those visits through the revolving doors of medicine. So that was kind of my awakening. And so for the past 5, 6 years, I've devoted my life to this topic of metabolic dysfunction, evangelizing it, thinking about it, researching about it, starting a company, Levels, which helps bring metabolic awareness to people, and then ultimately writing Good Energy as really a vision for the future of personalized individual health, so each of us can understand in our own lives. It's not that complicated. It's actually easy to understand through basic biomarkers. And then a vision for the system to update, to follow the actual science and focus on metabolic health for Americans.
Wow. So that's so interesting. So I guess my question is, you just talked about like the profitability, and it's not profitable, and that's why, doctors aren't really looking at it. How do you see that changing? How do you see root cause becoming something that more doctors will focus on if it's not profitable?
Does it have to come more from a patient's point of view to say like, hey, I really want to know why this is happening?
I think it does. And I do think there's really interesting trends happening right now. There's a couple ways to answer this question. The first is that it basically has to change. The reason for that is because it is totally insolvent the way that we're going. We spend 23% of the largest GDP in the history of the world on healthcare, and we're getting sicker every year. It's not working. And it's actually, the healthcare is the largest and fastest growing industry in the United States. Isn't that wild? Fastest growing and largest, employs tens of millions of people. It's a $4.3 trillion industry, and the outcomes are getting worse every year. So we actually, it is unsustainable, and it will have to change. So that's step one. Step two is that there's really interesting movements happening, I would say, outside the healthcare system, because you see with, what people are listening to with independent media, with podcasts, some of the top podcasts in America, as you see, it's like people are talking about metabolic health. We're not so much seeing it on the mainstream, but people are diving really deep. And for better or worse, people are finding their healthcare information kind of outside the doctor's office. And that is where we're talking about more, I think, metabolic health. So there's going to be this consumer-led demand of doctors to basically focus on this, or people are going outside the system, which is why you see all these startups happening that are outside the system. Things like Levels and Aura Ring and 8 Sleep and One Medical and Parsley Health and Next, like all these things. And so people are starting to really move towards that. And you actually see people picking plans now, like healthcare insurance plans that are actually very high deductible, low cost plans where they can max out their FSA and HSA, so they can actually just buy healthcare services outside the system. So there's fascinating trends happening. But how it really would change, I think, is moving towards truly a value-based care system, which is right now it's fee for service, right? Doctors get paid for what they do. And actually the unofficial mantra in the hospital, when you're launching out into private practices, you eat what you kill. And every young surgeon learns this, which basically means your income is related to how many surgeries you sell. That's the unfortunate reality. We got to move away from that. We have to move. So the value-based care is essentially that doctors get paid for outcomes. If you provide high outcomes for low cost, you get paid more. So that would be a whole different system. And that actually, they tried to do that a little bit under Obamacare, the Affordable Care Act. But the funny thing is, pharma got their hands on it, and the value-based metrics that doctors had to report on essentially became things like, instead of like, oh, is your patient actually healthier? And doctors had to report these metrics to Medicaid and Medicare to get these higher payments. The outcomes that made it into the official guidelines were how many of your patients are on long-term medication therapy. So not, are you producing a healthy patient? Are you producing a compliant, well-medicated patient?
So they flipped it. They flipped it around.
So good outcomes still became a medicated patient, not a healthier patient. So you can see there's ways that this can get distorted. So I think that we're seeing an incredible bottoms-up revolution happening in healthcare. It's beautiful. And I think it is going to drive the system to change, because people are going to stop going to hospitals and doctors that don't provide a bit more of a root cause perspective to health. And I think it's an exciting time right now.
That really is.
I mean, ironically, Jen and I went to one of these places last night that's like outside the healthcare system. They were kind of like, had their like little launch.
Have you heard of Extension Health?
Extension Health?
And they're here in the city.
Ooh, it sounds very familiar. I don't know. Yeah.
But there is something about it when you walk in that you feel like you're in a science fiction movie. Like it doesn't seem, you have kind of a curiosity,
you're not used
and
to
you're
it.
not used
You're not
to
used to seeing
doctors kind of trying to diagnose you from like the root.
That perspective.
You know?
And then treat you with alternatives versus, traditional medicine. But I love that. You said that was really an education for me, that what you just said, because I never really thought, I didn't know that. And I love that there's hope there, that it could be this outcomes-based driven type of a, healthcare system, because otherwise, like, you're right, we're going to keep getting sicker.
Yeah.
And we're going to keep doing that same cycle. But, and I think it's going to take a long time to probably have that evolve. I'm just thinking of like older people now, and like the non-compliance and my own parents, and thinking about like, they're so set in, well, the doctor told me to do this and I take these 14 pills every morning and this is, and they're so conditioned. So it's like, how do you get people unconditioned and to unlearn and to know that these other options are they're out there, and B, they're effective.
I know. It's so difficult. I mean, my father recently passed away, and when going through his stuff, we found the list of all the medications he took every day. And my brothers and sisters and I were flabbergasted by the number. It was like, how is he even there when we were talking to him? It really was
like you would.
It was extraordinary.
And what are those medications doing
and how do
to
they
other functions in your body, and how are they? I mean, I understand like doctors know the interactions of medications, but at the same time.
No. Well, I always laugh. Everyone talks about, well, we're practicing evidence-based medicine. And it's like, that's a load of crock, because none of these drugs, the average patient is getting 16 prescriptions per year. There are no studies looking at the interactions between some set of 16 medications. Absolutely none. Not one. You can't do a study where you just put a big population on 16 medications. And see. So we are playing polypharmacy with patients with no evidence to support that they in any way can and should all go together. And so the doctors rely on the electronic health record to tell them if there's any drug interactions. But the second leading cause of death in the United States is medical error. So it's not actually like, oh yeah, well, it's all fine. I mean, and I think frankly, when you do take a patient like your dad who's on a list of medications and put them in like a functional medicine or a precision medicine, so a doctor who's kind of more forward thinking, they'll often rip off like 8 medications off like, oh, you don't need these. Like this is a medication that was actually prescribed to help you with a side effect of a medication you were on last year. Like you don't need this one anymore. Yeah. So I think it's wild. And, I think in my book, I talk about, the systems issues that really have led to this, because in medical school, it's almost like built in this idea that like patients are lazy, they're not going to do what you say. And so you just need to like prescribe them a pill. And all the evidence I've seen from patients I've worked with over the years is that people want to be healthy. People don't want to see their parents getting sick. They don't want to get sick. They don't want their kids getting sick. But everything about the system has, like you said, conditioned us to believe being healthy is hard or impossible, that salvation is found in a pill, that the medical information is complicated and we couldn't possibly understand it. All of the, and that people are non-compliant. All of this, I think, couldn't be farther from the truth. And it set up a system of a power dynamic where then the doctor has all the information. It's so hard to get access to our health records and even get a printout of our labs. And so we are just there in sort of this indoctrinated ignorance about our own bodies that then a whole system can essentially prey on. And so, I talk about it's sort of a scary chapter title, but I say, trust yourself, not your doctor. And I am not anti-doctor in any way. What I mean is don't blindly trust anyone. You should be using everyone as a data point and a source of information. But we live in a day and age now that is very exciting, because just over the past 2 to 3 years in history, we now have access to affordable, more direct-to-consumer lab testing, wearables. We can know more about our body through the click of a button online by ordering a set of labs than we could have known ever before. And so we all need to get off that indoctrinated conditioning about, it's the doctor's job to understand my health and be the CEO of our own health, because we can now, and it's not that expensive. And if we do have a grasp on our key important biomarkers, especially metabolic biomarkers over time, are tracking them, are understanding how they're changing, understand the basics of what they mean, we are going to be so much more empowered in this unfortunate power mismatch between us and the healthcare system. So that's really the call to action for people, is really realize that anyone above a 5th grader can understand what these labs mean, what these biomarkers mean. And we actually have to. If we can memorize our phone number, we can understand what our triglyceride levels are. It's not that complicated. So that's really a cultural shift that I think we're in. And it's starting with kind of our age group, I think, these sort of early women especially, and it's going to spread to our children and our parents over time.
Yeah, I hope you're right. I mean, we definitely see that even just on this podcast and the doctors that we speak to and the experts. And I can't tell you how many times, we've said, you need to be an advocate for yourself. You need to be, you like you just said, you're the CEO of your own body. And I think
you're the only one that's in your skin. You're the only one who knows what's going on.
But it's more than that. It's more. It's then taking that information and having a voice and being able to express that to your doctors, and then having doctors like you also be advocates and say, this is what needs to change. This is what we have to start looking at. I mean, do you think so? Are there right now? There's no general lab testing. Like you go to your primary care physician, you get your labs done. They're not looking at metabolic dysfunction.
Well, what's really interesting is that often they are ordering labs that can tell us about metabolic dysfunction. But I would say by and large, they're not interpreting them in a way that's truly reading the tea leaves of what's going on inside the body. What we're trained to do in medical school is open up the health record. There's a list of labs, and then there's either a green check mark. It's in the right, the normal range, which of course is not even the optimal range, or it's slightly off, borderline yellow, or it's red. And in the American doctor brain, it's like LDL high, prescribe statin, glucose high, prescribe metformin. It's very algorithmic. It's very up, bring down, down, bring, and it's what I really challenge people to do, and to actually do this for themselves by understanding the labs and the optimal ranges and sitting down with a pencil and a piece of paper with their printout, is to read the tea leaves of what the labs are saying to each other about our biochemistry. We need to look at them as a picture of what's going on inside our cells and learn, okay, what is a high fasting glucose saying about my mitochondrial function, which is where metabolism happens. How does my triglyceride and my glucose relate to each other? It's not that complicated. And when you understand a little bit about metabolic health, it all makes sense and you can start to see. So, I look at a lab test more, I blur my vision a little bit and look at it all together, as opposed to just seeing the algorithmic way. And that's what we need to move towards. So yeah, I would say the doctors are in many cases ordering the tests that we need to be ordering, but we need to kind of go deeper into understanding what they mean, which I think we can all do. Then of course, there are additional tests that are not standard and not ordered on our annual physical, like a fasting insulin or a C-reactive protein or a uric acid. And there's just a small set. I mean, in my book, I recommend 6 that everyone should get and every doctor will order, and then 6 that you might have to like kind of beg your doctor for. And then of course the sky's the limit on additional testing, but just with, 6 to 12, like that maybe cost $100 or are covered by insurance, you can absolutely get a great sense of your metabolic health.
Do you think there's a difference in young medical students now and doctors that are like up and coming now that is there a chance of that being changed as we speak because of like kind of this shift?
I think yes and no. I think there's a couple phenomenon going on that I'm seeing. One is that I do think with this access to more independent information about health that's coming out, you've got like Huberman, Peter Attia, these people who are, I mean, even to some extent, Joe Rogan, but Gabrielle, talking, these doctors and or people who are very large talking about this, people are listening. But I do think it's actually quite polarizing, right? Because if you're someone who, has kind of worked so hard to get to medical school, you're in $500,000 of debt, you really want to believe that the system is working, I think that it often will make you very adversarial to this other conversation going on. Because you kind of have to be, because we have to believe in this, this thing that we're sacrificing so much of your 20s and 30s to basically be a part of. Then there's the other people who are going through the system who are more, I think, of the rebellious and and really focused on health and, and who are saying, okay, I'm going to get inside the system. I'm going to get that MD, but I'm going to practice a different type of medicine. And I get emails from those types of doctors who are in their residency all the time because they're saying, how can I get involved with levels? How can I, there's an amazing medical student from Yale, or he's a resident right now, who he's now in his last year of internal medicine residency, but he's been emailing me since he was a medical student at Harvard and is basically like, we're not learning anything about metabolic health. I've been learning about it on my own. I am so disgusted by what we're learning. Like, how do I stay in touch and keep getting involved in this other side? So people like, and it honestly makes me so happy, but you got to imagine someone like that's feeling pretty frustrated. If you kind of know a different way, but you're in quote unquote, the best institutions in the world and you're not hearing anything about it. So I think maybe unfortunately a little bit of a polarizing, I think there's a lot of my friends from surgical residency who are still deep in the system. They're now faculty surgeons. Like, I don't think that they're thinking a lot about the stuff that I'm thinking about. And so we've kind of gone in different directions and that's okay. But, we just got to keep talking and educating. And the reality is it's not an either or. We absolutely need incredible cancer surgeons for when the cancer develops. We need people to drain the pus out of the brain when an ear infection goes to the brain. But we also, how wonderful would it be if all those doctors also were really had a holistic focus on how to keep people as healthy as possible, and we're incentivized to do that financially. That's the world. It's a yes and. So that's what we've got to bring together, and that's the world I'm imagining.
Tell us a little bit about Levels.
Yeah. So Levels, the health technology company, and our mission is to reverse the metabolic disease epidemic. So tall order, since 93% of us have metabolic dysfunction. But it was born of really a sense of some of this rebel energy of, hey, okay, we have this device, a continuous glucose monitor, continuous blood sugar monitor, a little wearable that you can put on the back of your arm that is available right now, FDA approved, just for people with type 2 diabetes or type 1 diabetes. Those are the people it's approved for. And 95% of all diabetes cases are type 2 diabetes, which is, the one that you get later in life and that's related to diet and lifestyle. Hey, why are we waiting to give this technology that helps you understand your blood sugar until people are already sick, rather than far earlier when we could actually understand our diet, what it's doing to our blood sugar, and potentially intervene a lot earlier? And so what Levels did about 5 years ago is essentially take this medical technology and consumerize it, make it accessible to people who are, like so many of us, like the 50% of Americans who are going on a diet every year, who are trying so hard to figure out what works and are ultimately feeling frustrated and stuck. And so it's a metabolic awareness tool. It's looking at, okay, I ate lunch. What happened to my blood sugar? I took a walk after a meal. What happened to my blood sugar? I didn't get good sleep last night. What's going on with my blood sugar? And what's so crazy is that in 2024, we've hit the 50% mark of 50% of American adults have prediabetes or type 2 diabetes now. So a full 50%. In the 1950s, less than 1% of Americans had type 2 diabetes, and now over 50% have prediabetes or type 2 diabetes. These are almost entirely preventable cases. So Levels brings access to a technology that can help people understand their blood sugar and manage it before it turns into full-fledged clinical disease. So we do that by, we have a telemedicine network that helps facilitate prescriptions to these devices because they are still prescription only. A pharmacy ships them to people's homes, and then they apply them at home to their self. And then we have a software that helps interpret all that glucose data to help make actionable insights about your diet, lifestyle, sleep, stress habits, all these things. And then we also, in an effort to get people more, because glucose is not the only biomarker that matters, it's a very important one, but we also want to see the other context of what's going on in the body. So we also have lab work that people can get. So it's just a really easy way to get your metabolic lab work and go and walk into a lab and get it drawn and for a very affordable price. So people could then, without having to beg their doctor, go get maybe their key metabolic labs done every quarter or something like that for about $100. So that is the ecosystem of Levels, is learn how food is affecting our health so we can make better decisions and hopefully avoid this almost inevitable trajectory that's happening for most Americans. And, it's not available to kids yet, and I don't know if it should even be available to kids, but the crazy thing is that I don't know if you know this, but 30% of teens now have prediabetes. So this is, it's becoming it's astronomical. And everyone with a blood sugar problem, like that is going to be the foundation of being set up for all the chronic diseases that are facing Americans. We got to get the blood sugar under control. So that's really the goal of the company.
So, oh my gosh, that's an unbelievable percentage from the 1950s to today. What do you attribute that to? That's a huge number. I mean, is it lifestyle factors in addition to diet? What other things are going on that are causing that big discrepancy?
Yeah. Well, so important, I think, to back up for just a quick, like the quickest little science lesson, which basically only takes remembering that the mitochondria is the powerhouse of the cell from high school biology. So essentially when we eat, we take in food, and we take in about 2 to 3 pounds of food per day, about 1,000 pounds per year, about 40 metric tons in our lifetime. So a lot of food. And that food is basically potential energy. It's many things, but one of the things it is potential energy that we cannot use. We cannot use that energy from food. We have to convert it through the mitochondria to a source of energy to power every single thing that happens in our body. So that's metabolism. Simply put, potential energy from food to human energy that we can use. And we make energy 24 hours a day, 7 days a week. Basically, death is the absence of metabolism, right? If we don't have energy, we stop, and that's death. So we have to have that working really well all the time, because we have like trillions upon trillions upon trillions of chemical reactions happen in the body every single second. We have about 40 trillion cells. They're all doing trillions of chemical reactions per second. That all requires energy. And if that's working well, it bubbles up into a healthy functioning body. And right now, 93% of people, that flow of food energy to human energy is problematic, because the mitochondria, that beautiful organelle inside the cell that does this process, this little factory of energy, it's broken by almost every aspect of our modern diet and lifestyle across 9 pillars. And so I'll briefly run through what those are. So you go into the PubMed, millions of scientific papers in there, and you start looking at what affects the mitochondria. And it's basically everything that has changed in the last 100 years in our urbanized, industrialized, rapidly changing world are hurting this beautiful part of our cell. So you look at the toxic industrialized food, that's covered in glyphosate and pesticides and is nutrient poor because our soil has been just destroyed through industrial agriculture. That's hurting the mitochondria. You look at our sleep. We're sleeping 20% less than we were 100 years ago. Our sleep is fragmented. Our consistency, quality, and quantity of sleep have all taken a hit because of our digital modern world. Our emotional health is in the toilet. 40% of 18-year-olds have a mental health diagnosis. The chronic, low-grade, unprecedented stress from technology, from sensationalist, violence-based media, because if it bleeds, it leads, just constant ping of fear of violence. And then, of course, loneliness. Our emotional health is poor. And emotional health being poor increases cortisol, increases our sympathetic nervous system, fight or flight. That also hurts the mitochondria. Then you get to our movement. The average American is sitting 80% of the day. We have these beautiful mobile bipedal bodies. We're sitting 80% of the waking day. We're not moving. Movement is what literally stimulates the mitochondria to do its work, and we're not moving. So they're just kind of these stagnant, lazy mitochondria that aren't processing blood glucose to human energy, ATP. Then you've got environmental toxins. Over 80,000 synthetic environmental toxins, virtually unregulated, produced by industry in the last 100 years that many directly affect the mitochondria or other hormones that impact the mitochondria. This is things that's like in our furniture, our electronics, our air, our water, on our food, in our food, the stuff we're slathering on our bodies, all of these, it's in our electronics. These are chemicals that are hurting our cellular biology. The last couple get a little bit more out there, but they're actually quite important. Our relationship with light has changed immensely in the past 100 years. We've moved very much to an indoor living. We're basically not exposed to the sun's energy during the day because we're all indoors. And then at night, we get all this artificial blue light from devices. So circadian rhythms and the clock genes in our body dictate our metabolic activity. And right now we have totally confused the human body. The body doesn't know what time it is because it's not seeing the light cues during the day that it needs, and it's seeing light cues at night. So this beautiful diurnal pattern of human biology, which is supposed to do certain things during daylight hours, and it knows when it's daylight because of actually the retina seeing photon energy, and then not doing certain things at night, has been totally turned into chaos. Our relationship with temperature has changed. 100 years ago, we didn't have AC. Most American homes didn't have central heating. So we were exposed to extremes in temperature on a regular basis. And crazily enough, temperature and thermal energy, cold tells the body to do certain things, hot tells the body to do certain things. If you're cold, it literally tells your mitochondria, do more activity to make heat, to heat me up. Wow. And if you're hot, it turns on genes called heat shock proteins that increase our antioxidant defenses that protect the mitochondria. And the last one I'll mention is medication. Like we were talking about earlier, we are on tens of thousands of medications being produced over the last 100 years. And many of them hurt and are toxic to our metabolic pathways as sort of a side effect of what they're doing. And so to answer your question, the modern world we are living in many ways, is no longer conducive to mitochondrial health. Because of that, we have a broken pathway of food energy to cellular energy. And therefore, the cell tries to protect itself by essentially blocking the entry of these food substrates into the cell because it can't process them. The mitochondria is just like a damaged little, and what happens then? It rises in the blood. That is prediabetes and type 2 diabetes. That's why our blood sugar, the cell is rejecting it. That's called insulin resistance. The cell base. So what do we do to those people? We jam them with insulin and say, get that glucose into the cell without actually having a compassionate perspective on what's actually happening, which is an underpowered, broken machine. So what do we really need to do? We need to take away the things in the environment that are hurting us so that flow can happen in a functional way. That would bring the blood sugar down, right? Because then the cell is able to take it up again and process it. We don't need to just in our, this crazy, sort of, I would say in some ways, masculine energy of healthcare, just force it, push it, do it. It's like we need to actually have compassion for the body and realize it is getting crushed by modernity and we have to support it so it can do its best work again. And we start moving towards health.
And I think, your company Levels, I think that is that will help people to understand this better, because I don't think the way you just explained it, that makes perfect sense. And I don't
to
think,
me too. Like,
right? I don't think people really get it.
I mean, she tries to explain this stuff to me all the time. Quite frankly, she
Well, it's funny
accomplish
because
it.
we both wore CGM. It was like 6 months ago.
Yeah, a while ago.
And I'm checking it and I'm looking at how like what I ate affected, and then stress. And I was like, and she's like, I'm wearing mine.
I wore it too, and
She
I was
goes,
checking it incessantly, and I'm like, I don't know what this means.
It was very funny, but that was that's so
you
interesting.
You made me want to wear it again, though.
Yeah, me too. To kind of like really look at those
sure.
levels. But there's nothing similar to a CGM that would measure insulin, right? Like on a continuous basis.
It doesn't exist yet, and it's being worked on by a lot of different people. Yeah,
really?
That would be
Everyone's trying
hugely beneficial. Yeah,
yeah.
The technology is
get to
difficult. Yeah, because insulin's a really big protein, and glucose is just a very, very small molecule. So actually, from just a technical perspective, it's much harder to continuously measure big proteins. And so, but there's, I think we'll see it eventually. It's continuous monitoring is here to stay. And right now, the only thing that we can actually continuously monitor on the body that's inside the blood is glucose. They're now coming out with ketone and lactate continuous monitors, but we don't have access to those yet. So
I want to get into, so we recently went to a biohacking conference, Dave Asprey's biohacking conference.
Which we had a blast. It was really fun. And a very eye-opening experience to know all these things that are out there, like literally gadgets, I mean, for lack of a better word.
Technology, all the technology.
Yeah.
But I want to just talk about this idea of health optimization. First of all, can you explain to us what optimization culture means?
Yeah, I mean, I think when we're talking about this whole optimization, biohacking culture, it's people really wanting to go so much further than what healthcare is offering. Because right now, healthcare, its main dictum is like, how do we prevent this person from like dying, not how do we help them thrive.
Right.
Very
how do we help them instead of, how do we help them live versus not die?
Right.
Yeah, it's a big difference.
And once we've kind of figured out, okay, I think I've got the basics to not probably, be in a high risk category for chronic disease. Like, then it's like, okay, in this precious brief moment that we have on earth in this body, how do we make it freaking awesome? How do we like make it as great as possible? And maybe even add some years to our lives, because this is what we got, right? This is our time. And I think in one of the things that I think is such a root issue of our healthcare crisis is that in many ways as people, we've kind of forgotten that we are complete miracles, right? Like how crazy it is that we're here. Like, and this is our time. Like it's eternity and we're here. And so it's like, how do we feel as good as humanly possible during this time? So for me, that's what health optimization means. I think, I think that it's a bit, I would say the culture and the conversation around longevity and optimization, like in a way, I sometimes question a little bit like the tone of it, because a lot of it now has gotten to be a little bit about how do I live as long as humanly possible and how do I like outsmart biology and things like that. And to me, and I think like where I like to start the conversation about health optimization is more from this sense of awe, this sense of appreciation for the miracle of the body, that like, it's amazing that we're here. I feel honored to be having this experience and to have this sort of, it's such a mystery, right? And like, so how with my choices and with what I invest in my health, do I honor this experience so that I can, that each day can be as healthy as possible? So less about avoidance of a bad outcome, which is death in sort of the longevity conversation, and more about like, if I can do things to make the present moment as transcendent as possible. And so, I think that, there's more women, I think, entering the biohacking space now, which is great. But I think, there's kind of an interesting balance between that sort of avoidance of death and like, actually, how do we just like have the most beautiful present moment possible that we can? So, but I think that's kind of what health optimization culture is about.
Yeah. I have a comment and another question about that. So we interviewed Peter Crone, and he talked about exactly what you're saying. He had said, we were at this conference and someone was walking around with a shirt that said, "Don't die." Right. And he was like, and he was really he was at this conference because he was asked to be there, but you could tell he definitely had another opinion about some of these things. And he said, why don't we focus on living? Why don't we focus on,
not don't die.
Yeah, he's like, I wish the shirt said just live, instead of, but I guess, and I'm like, right? I mean, it's kind of impactful, but so my question is like, how do you integrate these principles into your life?
Yeah. Well, first, I just, with that comment that you were just making, it makes me think of the Steve Jobs quote that I love, which is that death is life's greatest invention, because without it, all of this would really be in some ways meaningless. If we didn't have, first of all, the mystery of death and this, like, what does it, is it, who knows if it's an end or more of a comma? We don't really know, but I think that it makes all of this so meaningful because it's, in a sense, finite. And so I agree with that so much. It's like we have to appreciate death for being the thing that creates all the meaning we have here in the preciousness and the ephemerality of this experience. And how do we honor that rather than avoid it? Because we don't know, it could be like many spiritual traditions suggest that the death is actually the liberation, towards the universal source that, and the, if we're a duality of mind and of body and spirit, that we actually just go back to that. Who knows? We don't, it's like, I do think that there's something really important there that actually has to be brought into the health conversation, because if it's all about avoidance of death, it will make us make choices that I think don't actually necessarily make our life as transcendent and as beautiful as it could possibly be. If we focus more on maybe it's just today that we have, but let's just do everything we can to make today as incredible and healthy as possible. So I love that. In terms of my own life, sort of how I integrate this stuff. So, I think for me, I really do, even though I'm kind of like, in many ways, I'm a Luddite and I actually don't love technology. I want to be outside all the time. I really like, I would rather be backpacking than on a computer. Right. But like, to me, I do depend a lot on the wearables and the technology to help me, because it keeps me, I think people will say, well, tribal cultures didn't have this stuff and they lived until they're 90 or this and that. And it's like, that's all true, but we're up against a lot right now. And so the world, it has invisible threats kind of everywhere around us. So let's use technology to like help us. So I wear an Oura ring. I keep pointing to my ring, and I sleep on a 8-sleep mattress, and I look at my data every day. And when I wake up, because sometimes we don't subjectively feel that we're kind of going off course. We might feel tired, but then we drink some coffee, but we might not. These data are kind of a leading indicator often before we even subjectively feel like we're getting off course. The Oura ring was able to predict COVID 2 days before people got it, because it's before they even knew they had symptoms, because our bodies are constantly changing. Right. And so I love it to give me a sense of like, what's going on right now before I'm consciously aware. So I'm checking my resting heart rate to see if that's going up. That might mean I'm stressed or I'm tired or I haven't worked out enough. I look at my HRV, which is a measure of stress. And if that's starting to go down, we want HRV to be high. I think, what am I ruminating on? Like, what is there a physical stressor that I'm dealing with? Am I getting sick? Like, what's happening? How do I support myself? How do I have more compassion for my body? Because clearly it's feeling stressed. So how do I support it before it continues to be a pattern? I look at my sleep data. I know that for me, I really need about 7.5 hours of good quality sleep for me to be at my best. And the reason I kind of figured that out was because I gave myself about 6 years ago, just like a month to sleep as long as I wanted to, no alarms. And what happened is after about 3 weeks, I started sleeping 7.5 hours every single night. And I'm like, I think that's my time. I think that's what my body kind of needs. And so I make sure that I'm averaging at least 7.5 hours a night over each week. And I look at all that data. So that really helps me, especially as like the A-type, Westerners that we probably all are. Looking at the data allows you to give yourself, I think, more support, because you're not doing it because you're selfish or, you're doing it because you're investing in a sustainable pattern for your health. I think about this. I haven't had kids yet, but when I'm a new mom, if I'm not getting enough sleep and I'm really starting to fall apart postpartum, it's like the data will, I think in many ways could help someone say, I need support because I have to be getting more sleep or I'm going to really break down. And so maybe that's when you feel, okay, I need to call in help from the family or from whoever. So so the data is definitely really important to me. I love what the wearables can do. And then I check my glucose data. What's happening? How many spikes did I have yesterday? What was it like overnight? What is my fasting glucose? And I make decisions about how I'm going to shape my diet that day accordingly. Maybe I need to be building in more walks throughout my day if I'm in a particularly spiky pattern. Maybe I need to be a little bit more towards like low carb that day because, I was really spiky the day before. So just using it to real time iterate. And then on a longer term level, I do get my labs done every 3 to 4 months. I use a company called Function Health, which is an incredible company that has, similar to Levels, consumerized access to 109 biomarkers that you pay $499 and you get 109 biomarkers drawn and a follow-up test. So if you do that twice a year, it's essentially $1,000 and you can use HSA and FSA and you get to see your full panels 4 times a year with interpretations, functional medicine interpretations. It's a Mark Hyman founded the company. And so you kind of have that Mark Hyman bent on the interpretation. So that's kind of, and then, like all the pillars we talked about, I just do my best to cobble together as many of the, those pillars as possible every day. I try to spend as much time outdoors as possible. Outside my office here, I have a standing desk outdoors. So
nice.
I work at a standing desk outdoors unless I'm doing a podcast. I try to get 10,000 steps a day. I am doing resistance training a couple times a week. I buy most of my food at the farmer's market because that avoids all those problems we talked about with the food. And, just each day with the capacity I have, maybe I'll, cobble together a few more. I'll, do the meditation or make sure I'm avoiding blue light at night. But it's like essentially always keeping those things we talked about in mind: the temperature, the food, the emotional health, the sleep, the movement, the light, the temperature. And how do I just bring as many of them in as possible to support my mitochondria each day? And that's really the focus of my energy. How do I love on my mitochondria as much as possible with my choices?
And base everything off of energy,
totally,
instead of, just to your point about, we both wear Oura rings too. And I think having that data is so important because, like you said, you figured out what your chronotype was, or Aura figured out your chronotype just by doing that little, self-imposed sleep study on yourself.
Yeah.
And it's funny too, like, so my boyfriend is also, he considers himself a Luddite and he does not. He is like, he's not on any social media. He has an Android phone. He would have a flip phone if he could. And recently I got him the Whoop band and he's been wearing it. Now, this is after like 2 years of teasing me about my obsession. You're obsessed with the Oura ring. You're obsessed with looking at it, and the workout doesn't count unless your watch was on, and all these things, right? I'm like, it doesn't, right? But
no, it doesn't.
Now he wears this Whoop band, and now every day he's like, Jen, this is so cool. Do you know that blah, blah, blah? And then last night I'm like, really? Oh, that's interesting. So if I can convert him to adopt some of these things, I think there's hope.
Yes.
I think there's definitely hope.
I think my problem is that I collect all this data and I really don't know what it's saying to me. I don't know how to adjust. Like I don't.
But you have me.
Well, I do. Thank God. Because she's like, no, you have to do this. And I try to remember what she says, but, I don't get a lot of sleep. Just you saying that you did that for a month, I literally stopped listening to what you said because I was like, wow.
You could do that.
Could
in
I
August.
do that?
You could do that.
Yeah. Just
That'd
to
be a fun
like figure out
experiment.
how much, because I get up very early and I even get up sort of early on a daily basis, when I don't
But
have to
now
get up
you have
early.
the whole month off, so you can maybe like sleep and see.
Sleep and see.
Yeah.
Ooh, that
So
would be
it's
so
just like interesting. Yeah.
Yeah.
That's all. I was like, oh my God, I'm so jealous of that personalized sleep study.
I know. I mean, that's very cool.
Yeah.
I recommend it because you might be. What was interesting is like the first few nights I was sleeping like 9 hours a night.
Yeah.
I was like, my body was like, screw you. You have been abusing us with the 6 hours a night.
Yeah.
And we're just going to sleep. I think I had like an 11-hour night in there. My body was just like, and then it just quickly went to 7.5, 7.5, 7. It would be like 7:29, 7:31, 7:28, 7:31. And I'm like, oh my God.
Yeah,
like,
you're right in that range.
I can't believe in 30, I was like 30 at the time. I'm like, I've never given my body the opportunity to just have the sleep it needs. They've actually done incredible research on this where you put wearables on people and then you ask them to self-report their sleep. And there is there are people who are reporting 8 hours of sleep per night who are actually getting an average of 5 hours and 50 minutes of sleep per night. And you once you start, you see how that could happen, right? Like,
totally.
They cut a little bit, 10 minutes here, 20 minutes here, then they don't account for their time awake at night. And all of a sudden it's 2 hour difference. So we have to be realistic because sleep, the difference between sleeping 5 hours and 55 minutes a night versus 8 hours of sleep a night is the difference in many cases between like developing a chronic disease or not. And so we got to get realistic and not overestimate our steps, our sleep, our active minutes per week, because we're really sick as a country and we're really busy and distracted. And we that's where I think the wearable data can actually just hold our feet to the fire a little bit and be like, you're not actually doing what needs to happen. And to me, that's so motivating. So that's one of the things I love about it.
Yeah. And just on the flip side of that too, just for me personally, because I'm a personal trainer and nutritionist, like I'm very active and I'm always moving around. And it almost, when I look at it, it gives me that, it's okay to rest. It's okay to take a break.
She does not think it's okay, just FYI. She's a big talker here, but she does not rest.
I know.
We joke a lot and we've said it a lot. Like we do, you're a captive audience. Casey is a doctor. And so we like to, share our own personal. We like to use you for you.
I love this.
But I think, how would you go about helping yourself diagnose like a root cause? Like I have this, here's my turn.
Oh yeah, you have something.
I have this terrible skin something condition gone. I've gone to many dermatologists. I've been to an eye doctor, and I feel like I've developed eczema at a late age. I'm 60 years old. I don't, I never had skin issues ever. I didn't have acne. I didn't, nothing as a kid. And now all of a sudden, I'm under much more stress. I've had stress, in recent months, but all of a sudden it's like coming out as like these skin irritations on my face, on my arms. How do you go about figuring out what is actually, because I feel like that's the only answer, like, especially in talking to you and seeing your book, like that's actually what I really need to figure out. How do you go about finding that?
Well, the way I just like big picture think about any symptom in the body is that whether we like it or not, because the symptoms often aren't fun, the eczema, is that symptoms are ultimately the way that our body is talking to us to tell us that some of its needs are not getting met. Yeah. That's what a symptom, any symptom in the body, any symptom, any disease, but really just, what we feel, it has to be the result of cellular dysfunction. And I think that sounds a little funny, but it's like, nothing arises in a vacuum. So if something's happening that you're feeling or that's going on in your biomarkers, there's something happening under the surface. And what we have to do is figure out what is causing that dysfunction. And so, step one is literally just sitting with yourself and slowing down and really thinking about, and it sounds like you've already done this because you just told me you've been under a lot of stress.
Right.
Like you've already identified that. What is my body trying to tell me? Ask yourself, and this gets a little hippie, but it's like, what is my body trying to tell me? What are you, my body, trying to tell me with this symptom? And sit and listen, because it's so funny. It's like we have this body that has amazing wisdom, and yet we never really just sit and like ask it, what are you trying to tell me? Often the answers. And then I think the other thing is that if what we're dealing with is maybe something more related to inflammation, and eczema is an inflammatory condition, right? Like a skin issue that you're dealing with, maybe itching or redness, this is fundamentally inflammatory. Well, back up and really think about what is inflammation. Inflammation is the immune system kind of revving up a response, releasing these cytokines, which is what creates itching or redness or kind of the stuff. And it's inflammation is the body the body's army perceiving a threat and then getting activated and then not settling down.
Wow.
So essentially it's a form of biochemical fear and threat response.
Wow.
So what we have to ask ourselves is, knowing what we know is in our environment, all those pillars that we talked about, food, sleep, emotional health, toxins, what is my body right now afraid of? What is causing fear in my body that is causing my immune system to get revved up? And it's not just thoughts that lead to that. A toxin could be causing your body to be, a new laundry detergent that has some type of, chemical in it that your body's not used to. It could be a different type of food that you're eating, or oil or something like that. But going through each and every pillar that we talked about, all of which can ultimately be threat signals for the body, and asking your body, has any of these changed over recent history to cause a new sense of threat in my body that then is responding with these symptoms that I'm having? And so it could, that would be a journey to kind of go. And actually in the back of my book, I have a bunch of essentially quizzes that are go through each of these pillars with all these detailed questions, so that people can just sit and take stock of like, what is actually happening? Things people might not have thought about, like, has my water changed or something like that? But kind of with that compassion for the body, asking like, what is my body trying to tell me, and what kind of threat is it experiencing that I could take away so that it can relax a little bit. And you mentioned that maybe it's been a couple stressful months. That might be one of the puzzle pieces. Maybe there's 2 or 3 others that you can identify. And then the work and the challenge is, of course, how do you change that reality?
I know.
Right? How do you manage whatever's going on emotionally? How do you? So that's kind of like the high level. That's the sort of like more subjective, like go through this. I think that is always step one. No biomarkers are really going to be that helpful if you're not doing that first piece of the puzzle, the analog part, the like just thinking and reflecting on the potential triggers going on. Step 2 is all the stuff we've talked about. I would get the full blood work panel. I would see what your CRP is, your C-reactive protein. Look at the constellation of inflammatory markers, which would be like CRP, ESR, erythrocyte sedimentation rate, white blood cell count, a couple others like acute phase reactants. Look at that. Get all your blood work done. And if you have a baseline from a few months ago or a year ago, see if anything's changed. That could be a clue.
Wow.
And of course, look at your other data. One of the features I love in Aura is it looks month by month, your averages. So if you click on the month button, has your HRV gone down? Has your sleep gone down? What has changed? And I think together with all of that, and then hopefully having like a really wonderful doctor who can support you in that. So maybe that's a functional medicine doctor, sort of more precision medicine. I think, often we can find the answers through that kind of picture.
Yeah. Because I do find myself, which is what you say, it's like you treat all the symptoms. I'm treating the skin, but I'm not treating what's causing it,
Yeah.
So.
Like I think about if someone's giving you like an anti-inflammatory or like a cortisone type medication for your skin not asking you. So the mechanism of action of that drug is to diminish an immune system upregulation. So if we're not also asking, what is the thing that's making my immune system think there's a threat, we are missing 90% we're basically silencing what our body is desperately trying to tell us.
Wow.
Yeah.
Wow.
Not to say you shouldn't use it, but it's like
a lot of it is on my face. And I'm just like,
but it's
oh my God.
It's how do you use it and also see these things as a signal of something we could be diving into.
Yes.
Sometimes that cortisone cream could just
oh my
save
God,
the
it
day.
does. It does wonders. I have a whole battery of things and potions and things that all seem to,
But one thing I will say that she tried was red light therapy, and the red light therapy really helped.
Really made a difference. It's so.
And what does red light therapy do? It supports our mitochondria.
Cellular level.
Yeah, I mean that really does. I never would have. I'm a non-believer of all these kinds of things, but I am a believer now for sure. It's so crazy.
After we went to the biohacking, you were like,
I was like,
in.
yes, I'm doing all of it. I want a cold plunge. I want to this. I want to that. I want to do all the things, that I can. But yeah, it's crazy what you can do to help yourself.
Yeah.
You know?
Yeah.
I think that kind of world that opens up to you.
I
you
think
know?
Even things like a nutrient deficiency can make
Yeah,
your body
sure.
feel
Yes.
scared,
Sure.
you know?
Yes.
So it's like, what kind of labs can you do to see, like, maybe
Yes.
it's like a B vitamin is low. It's like, it could be
Yes.
that simple.
Such
It can
a
also
crazy
be much
thing,
more
yeah.
complex, you
Yeah.
know? But if the body's out of sorts, it's like, that's what medicine needs to be, is figuring out
Sure.
why is it out of,
Yeah.
sorts. So
Yeah.
yeah.
We-
And then
what do you-
turmeric, we talked about it earlier.
Turmeric.
but
Yeah,
Yeah,
no,
yeah.
definitely.
Take the 2,000 milligrams.
Yeah,
Anything
I will.
inflammatory, I'm like, take the turmeric.
Turmeric.
Yeah, I will. I have it all. I truly have it all.
Yeah. And then my last question is, will you come back? Because I have 4 pages of notes.
We didn't do one thing.
I didn't ask you one question on
Not one
my
question.
list.
But
oh
I
my
have
God,
to say,
this was fantastic.
I have loved this discussion. I love your book. The book is good energy. Read it, and you will get a lot of sage, wise advice on how to live your life. So, Dr. Casey Means, thanks for being here. We've loved
you.
talking with you.
Thank you so
Oh
much.
my gosh, I'll come back anytime. And thank you so much for having me.
So she was fantastic, right?
I loved her.
Yeah.
I'm so glad we had that little run-in with her a couple months
a
ago.
few months ago, and her book is very interesting.
The book is great, but I just learned so much just
Yes,
now.
yes.
And I really hope, it sounds like there is hope that we are going in this direction of healthcare from a root cause perspective,
know.
and more doctors will embrace it. Hopefully they will be incentivized to do that.
Yeah, I feel like it's not in our generation, because I think I still am like bridging the gap between listening to what my doctor said and wanting to get other answers. You know, I think
Yeah.
like in like my nieces and nephews' generation, they'll much more
Embrace this and
embrace
question
this
it,
kind of
yeah.
new way of going to doctors. You know,
It's funny. I feel like all I do is fight doctors.
I feel like that's true.
I-
I feel like
because we have all this information now,
know.
and then when I
know.
go, and not just for myself, but like for my parents or whoever, you know, it's like,
know.
no, I'm not accepting that
I know.
answer. Don't just give me this
I know.
drug.
I feel like my dad was like that, and I've said that before. Like he had this pain in his ear, and
He was persistent
he was
about
so
it,
persistent about it, and he went to so many doctors who
and they kept
they
dismissing
kept
him.
dismissing it until it turned out to be the cancer that had returned.
Right.
But why couldn't they have figured that out?
Well, that's the thing,
yeah,
and it's like,
but he kept he did
Yeah.
all that he could,
and that's
you know, I
frustrating
think.
because the doctors weren't
Yeah.
listening. You know, and she has a story
Yeah.
in her book that we didn't ask her about, but about her mom.
I know we did not,
And I
which
really
I'm
wanted to
sorry that
get
we
to that.
didn't.
Yeah. And similar situation,
Right,
where
where like she was healthy.
and they kept dismissing her,
Yeah.
her, whether she was misdiagnosed
Right,
or
right.
they said she was fine, and she ended up dying prematurely,
Right.
and she didn't have to. So, anyway,
Yeah, another good one.
her book is Good Energy.
Yep.
Read it.
Casey Means.
Get a lot out of it.
Yeah, we sure did.
And we will link all of her other information in our show notes so you know where to find her. And
Yeah, I'm Lori Shulweiss.
and I'm Jen Giamo.
This was Everybody Talks.
Talk to you next time. For more information about our podcast, to learn more about us, and to catch up on all of our episodes, go to our website at everybodytalkspodcast.com.
Follow us on Instagram at Shuli, at Jen Giamo, and at Everybody Talks. And if you want to watch today's episode, go to our YouTube channel at Everybody Talks Podcast.
Join the Everybody Talks community by checking out our Patreon page, where you can become an exclusive member of our wellness group and be a part of the conversation.
And don't forget, if you like what you've heard, give us a 5-star rating, write a review, and tell a friend. We're for everybody and everybody. The Everybody Talks podcast is co-created, executive produced, and hosted by us, Lori Shulweiss and Jen Giamo. Produced and edited by Station 16.
Our theme song music is written and performed by Jackie Ryle and Aaron Navisi, with additional support from our pups, Oliver, Milo, and Murray.
Talk to you next time.